Hey everybody, little update on Petey. He's doing good. We are now, Friday was 72 hours. It is Saturday evening, so we're almost 5 days out from his injury. He is doing good. I was just holding him a moment ago. But I thought I would go over some of the stuff that we are using currently to treat him, as well as stuff that you should just have in a supply kit for reptiles, just in case. First thing first, scales. Always have one. It's always good to measure your snakes or your reptiles, make sure they're gaining weight appropriately, or if they're not eating, to find out how much weight they're losing. It's a good thing to have. Next thing I have is a small bin with paper towels. Paper towels are there to line the hospital bins. This bin I'm not using for his hospital bin. We actually use it for various other things like transportation if we need to move him, as well as if you have to soak a snake or a reptile and get fluids in them, or to treat injuries. It's good to have one. I actually don't like this bin, however. The clips are nice, they are good, but in Petey's case, there are these little spots right here, and he's wedged his head in there and he will start turning to try to dig. He's trying to dig his way out. Unfortunately, with his injuries, I was worried about him popping open his wounds. So what you want is just a plain bin that just has a lid that snaps on, or doesn't snap on the top like this, no clasps, but just places on the top that doesn't have these little bits of plastic that they can wedge their heads in and try to pry open and end up injuring themselves further. So not using this bin currently, but it does hold my paper towels, and it's there in case I need it. I have a larger bin with all of my medical supplies that I keep for them. It's also a good bin in case you have, and right now I'm actually, if you hear in the background, we are listening to some storm chasers because Texas is having a lot of tornadoes. There's a very large tornado down there. It's been going on for 45 minutes. Our thoughts are with everybody who may be affected by that tornado, but you might hear that in the background. But this bin right here is good. I have a bag full of bags that if I need to evacuate in case of a tornado, I can throw the snakes into the bags, put them in this bin. I'll need a bigger bin eventually because ball pythons do get good size, and so do some of the other snakes that I have. Honduran milk snakes, 5 to 6 foot snake. Gonna need a bigger bin. This bin works for now though, for the size of snakes I have. But we could throw all the snakes in there, pick them up, and get them to our safe room. If there's a fire, put them in there, get them out of the house. It's just an easy way to transport them. So big bin is great. This is actually the medical bin that I have. So here, what I have is a couple of different medications. These are actually fish medications, but some of them, such as Metroplex, can be used on the snakes. It's powdered. You need to find out what the correct measurement is and what the strength on this medication is, but you can dose your snakes, your fish. I've had to actually treat a axolotl, or ocelot as they're actually pronounced, with this medication when his water got too warm and he got infection. But a couple different medications. We have some polysporin. I've got some syringes, some needles that just drop anything I may have. We have, this is a goat dewormer, but if you have a parasitic infection such as roundworms, I think hookworms, this can be used, I think, on cats, but this is the goat formula. It's not as strong of a milligram, I believe, is the difference between that and some of the like equine and the horse ones. But this is good to have around in case you do get a parasitic infection. The Metroplex is good there for different kinds of infections. But we've got those just in case. Ooh, I am knocking over my bins on the other side. I've got some gloves. I've got a big old bag over here of cotton balls, but we got some Q-tips, some more syringes. Just have, you know, throughout the years. Which is kind of nice if you own a medical treatment company, you're doing like IV infusions and stuff like that. Your supplies may expire. Doesn't mean you can't use them on animals. Just because we can't use them on people doesn't mean we can't use them on animals. Anyways, though, I have some hydrogen peroxide, isopropyl alcohol. The hydrogen peroxide, if I remember correctly, if you get a crypto infection, unfortunately, you can't cure it within your snakes, but you can treat the equipment that you've used on those animals with hydrogen peroxide. It has to be over, I believe it's over 3% hydrogen peroxide. This one's not labeled on the front, so I actually should check that. But hydrogen peroxide is good for wounds as well. And then we got some Dawn soap. That is good if you get snake bites. You can treat them with a very dilute wash. You can actually soak them. There you go. Again, that soaking bin. You can soak them in some diluted soapy water, and that will kill the mites. That is that. Additionally, the supplies I'm using on PD right now, we got jumbo cotton balls. We have betadine, providine, iodine is the same thing. I just got the generic brand. It's good for humans, obviously, too. This is, I believe, prescription only, but it is silver cream. So what we do is we'll wipe down his wounds with the providine, iodine, and I'll actually, if I don't have any gloves, which I forgot I had some extra in here, but if I didn't have any gloves, I would clean my hands with the iodine, and then I would use my fingers to do his cream treatments. Silvadine is the name brand of similar products. Very good for healing. There's actually some mixed research that says it may not be effective, but any wound healing person will tell you this stuff's amazing. It's great to have. Manuka honey, if you're human, Manuka honey is another thing. It has antibacterial properties. It's produced, obviously by bees, but you can put those on wounds as well. It's great for healing. Additionally, we've seen this before. This is, I believe it's going to be a chlorhexidine solution. And I thought I had some chlorhexidine, but I actually don't see it in here, so I'm going to have to figure out where I put it. But dilute chlorhexidine, great for spraying down his enclosure or his hospital bin. I actually will clean it every day and then put down paper towels, plain white paper towels, no print on it, no ink. But that helps to keep his environment more clean to promote healing. Additionally, we have a little heater mat. And this is, that is actually, I'm going to pause this because that is annoying, but that is our weather alarm. One moment. I'm going to try to continue the video because the warnings keep going off. We're both in a tornado watch. No warning yet, and a flood watch. I think actually it was a flood warning. But, so sorry about the background. But anyways, so we have a Reptile heat mat. And the purpose of this is that we can actually heat up water. So if we had to do a soak on a snake or any other reptile, you can actually have it at a nice temperature for them. The warm temperatures also help promote digestion. So the soaking's good if your reptile is constipated. So we're promoting digestion using water and heat. But all you have to do, and this is not one I use, but you just take the bin, you put it on top, And then you want to have this heat mat actually connected to a thermostat. You don't want to just plug it into the wall because it's just going to heat continuously and you're going to get really hot water and a very possibly injured or dead reptile. But you're going to put it plug it into the thermostat, and you're going to take this little probe right here and you're just going to place it in the water, and so it can monitor the water's temperature and control, the thermostat will control whether or not that heat mat is working or not. So just turn it off and on. So great thing to have as well in your emergency medical box. So that's it. That's kind of what I'm working with right now, as well as other supplies I have in hand. On the chlorhexidine, there are two kinds of chlorhexidine, and I honestly don't know if there's a difference, but there is an orange kind that you often will see with humans for surgery. They'll have you do a little bath with it, and there's a blue kind. And everything I've seen, and you know, this is, like I said, I think that's a chlorhexidine. That's based off of the blue kind. So if you were to pick one up, and I'm going to pick one up because I thought I had one for the bin, but apparently I didn't. For sure, the blue kind's safe. I don't know about the orange kind, so I would not get that, would not use that on your reptiles without getting a vet approval or somebody who's in the know first to say, yeah, it's safe to use. But again, that's what we're working with. I do plan to do a video just showing what I'm doing for Petey. He's getting wound treatments 3 times a day right now, and again, he's getting shots every 72 hours. He got his last shot, or his first shot from me, which would have been his second shot, on Friday. So his next dose is on Monday. I don't know that I'm going to videotape that one because I'm going to be all hands on deck because he's very squirmy when he's getting his shots. But I'll show you how that goes and how we work that. But that's it. I'm going to go watch the weather people. It's just not good right now. Everybody be safe, and we'll talk to you later. Bye.